Anatomical Snuff Box.
So I'm going to show you the gross specimen of hand. These are the dissected specimen of hand. And these will be kept in your VIVA VOCE exams, practicals, spotting purpose. So because they're not like everything has been dissected out properly, but by VIVA VOCE spotting purposes, you just need to identify the tendons, the nerves, and vessels, and then it will become on your theory part of the VIVA. So we have got like 3 specimens here. This one, first thing is to identify the side of the specimen. So this you can see easily. This is of the right left hand, dissected specimen of hand and wrist of the left side. Even this one is of the left side, right? This also is including the lower portion of the forearm and the left hand, and this also is of the left side. So we've got 3 specimens of hand, dissected specimens of hand, and they are of left side. Now instead of like just explaining the tendons, I should I will go on explaining small little compartments: the flexor compartment, the extensor compartment, the structures passing through the retinaculum, thenar, hypothenar muscles, and the anatomical snuff box. So what I think I should, in this small video, I'll just explain you the anatomical snuff box. Let's see. Okay, so anatomical snuff box, anatomical snuff box is when you extend the thumb like this. So when you extend the thumb like this, even in life, in your own, you can see it on yourself, that there comes to be a depression here, right? And that depression is between the tendons, right? So there is a tendon placed laterally or posteriorly, because actually, remember the anatomical terminology, everything here is lateral and everything here is medial. So when you look at it like this, instead of calling medial and lateral, the better word will be this one is anterior, this one is a posterior. So that will be a better terminology. So when you talk about anatomical snuff, that is a depression or a snuff-like space at the level of the lower end of the radius and at the level of the base of the this first metacarpal as well as the carpals there, right? Scaphoid and trapezium. So what else can be asked, like what are the tendons forming this? There is posterior by a single tendon, that is extensor, pollicis, longus, and the anterior boundary is by extensor pollicis brevis and abductor pollicis longus. This you know it. Okay, then what will be, just I'm covering the VIVA VOCE portion. What forms the roof? Roof is formed by the skin, and there is a subcutaneous vein running, that is the commencement of cephalic vein here. Then artery here is the radial artery, which will dip down here by between the 2 heads of this first dorsal interossei. It will dip down and will reach onto the palmar surface in the adductor space of the palm to continue as the deep palmar arch. Then what else is here is radial nerve, right? Superficial cutaneous branch of the radial nerve, which supplies the lateral half of the dorsum of the hand. So these were the contents. Then what will be forming the floor? Floor will form by the styloid process of the radius, scaphoid, trapezium, and base of the first metacarpal. They will form the floor. So that was about the VIVA VOCE type of thing. Now let's see in the dissected specimen how you find out the anatomical snuff box, right? So this is of the left side specimen. Look here in the boundaries. Remember this the extensor retinaculum, which has been reflected out, right? Extensor retinaculum is an oblique band, right? From the radial side, it goes downwards and obliquely towards the ulnar side. So the extensor retinaculum is like obliquely placed like this. Okay, so it has been further compartmentalized into 6 subcompartments. What passes to the first compartment will be the 2 tendons from the back of forearm, and they will form the radial side, or you can say the anterior boundary of the anatomical snuff box. So these are the two tendons. You can see they are forming these are the two tendons. They're forming the anterior boundary of the anatomical snuff box, and obliquely running this one, right? This one you can see is forming the posterior boundary of the anatomical snuff box. The boundary, actually, you know what is coming in between here, this has not been reflected out, just to show you the cutaneous thing. This is like superficial fascia, the yellowish color thing in fact, and this is the formation of cephalic vein. So this you can see is cephalic vein, and it has not been reflected. Actually, it's a content of the roof of the anatomical snuff box, right? You can see it. So when you move it like aside, now you can better see that this is actually the anatomical snuff box. Here you see is this space down here, right? This is the posterior boundary formed by a single tendon, and that is extensor carpi radial. This one is extensor pollicis longus, and it emerges out through the third compartment of the extensor retinaculum by winding. So there is a dorsal tubercle of Lister, remember, at the lower end of the dorsal end of the radius. So it winds around this dorsal tubercle of Lister, and this is extensor pollicis longus. The two tendons forming the anterior boundary, extensor pollicis brevis. Look here. So because it's longus, you can see it is reaching to the terminal phalanx, right? While this one is extensor pollicis brevis, it will reach to the proximal phalanx. And this is abductor pollicis, right? So abductor pollicis longus, that also reaches to the medial side of this proximal phalanx, lateral side is for proximal phalanx. So together they are forming the anterior boundary. This one is forming the posterior boundary, longus. Now in this contents, as I told you, one will be the radial artery and radial artery down below, and radial artery, and the superficial branch of the radial nerve, right? And if you go further dissecting it out, then this muscle, remember, when you adduct the thumb, there's a muscular bulge here, and that bulge is the first dorsal interossei, right? It's bipinnate muscle. So this radial artery, it tips down between the two heads, and it reaches here on the palmar surface under this adductor pollicis. So that's like a content of adductor space of palm, radial artery, and there between the two heads of adductor pollicis, it emerges out to continue as the deep palmar arch on the palmar arch. So that is like, the contents in it. They are the floor you can even palpate. This will be the styloid process of the radius, right? So this is the radius, so it will be the styloid process of the radius here. Then scaphoid, radio carpal joint is between radius and scaphoid, and scaphoid terminally distally articulates with trapezium, and trapezium with the first metacarpal forms the styloid joint. So this is like, the floor of this anatomical